Hello and Assalamualaikum. Today I want to represent the Klebsiella Pneumoniae as my case study. This is the presentation. Okay, the aim is how to identify the Klebsiella pneumoniae by the case given, the symptom, clinical features of Klebsiella pneumoniae, and the difference between E. coli and Klebsiella pneumoniae. Okay, next we are going to intro the patient. Okay, a 70 years old man with a history of hypertension represent with fever, dyspnea, dysuria, and this just called discomfort for 1 day. He felt pain at abdominal. He denied any other medical history, including HIV infection. On arrival, the emergency department, his body temperature was 38 degrees Celsius and the blood pressure was 207 and 125 mm per Hg. The physical examination was unremarkable. So we're going to represent the lab diagnosis. Overview the illness or condition. Okay, we start the lab diagnosis, which is renal function. As you can see, the creatinine higher than normal range, sodium is lower than normal range, and the others such as urea also higher than the normal range. Next, glucose test. Okay, they did also glucose test and the result is higher. All of this is higher than the normal range, which is 11.6. Then the normal range is not more than 7.7, and the conventional one 209, but the normal range is not more than 141. And the HB1C test, which is the very important for the glucose test, is 12%, but the normal range is not have to no more than 7.5%. Okay, next, we also did the diffusion count for white blood cell for this patient. Okay, the value is the neutrophil. The neutrophil shows that it's more than the normal range, which is 40 until 70 only. But in this patient blood is more than 89. Next, urinalysis. Okay. We took the urine and we did the dipstick and the urine FME. Urine FME is microscopic. Okay, the appearance shows cloudy and pH is normal, but the urine glucose shows the higher than the normal range, which is 55, but the normal range is only 3, not more than 3. And red blood cell is not seen on the microscopic. White blood cell shows the abnormal because it's more than 6, which is the normal range, not more than, it's supposed not to be more than 6. And the cast and crystal is not seen, but the bacteria is 2+, which is quite a lot, and it seems. Next, we also sent the urine to make the AST and culture also. So this is the result, which is the antibiotics is sensitivity, shows sensitivity. Amoxicillin, cetismide, ciprofloxacin, gentamicin, centrazone, serofloxacin, ertapenem, imipenem, levofloxacin, cotrimazole, piperacillin, or tazobactam. Next, okay, this is the results, the proof that they are all in this. Okay, next. Okay, we also took the sputum of patient, and it shows that The sputum has white blood cell and shows the gram-negative cocci. Okay, next, this is the urine culture. We did urine culture and also blood culture, but in blood culture there is no growth, but in urine culture we did on clade agar and blood agar. It shows colony. Sorry, it's typo. It shows colony actually. As you can see, the picture shows mucoid colony. Okay, actually it's half. This one is other patient, and this one the patient we talking now. Same like this. This one. So it shows that the only these sides. So this one don't have, but these sides have. So it shows that the growth of colony. Next. Okay, the outcome of lab investigation. Okay, as you can see before, we shows the lab diagnosis, the culture, the AST, the diffusion count, and others, and we came to differentiate the E. coli and pneumonia, Klebsiella pneumoniae. Okay, as you can see, we did a test, citrate organism test, indole test, methylene test, and Voges proxcure test, and it shows that Klebsiella shows the positive, which is blue color, but if the test is negative, is E. coli, which is green color. And indole test also give the differential, which is E. coli is positive, has reagent ring, but the Klebsiella don't have because it's negative, no reagent ring. And methylene test, the Klebsiella shows negative. The observation is yellow or orange color, and the E. coli is positive, change to red color. And then the Voges proxcure test shows positive to the Klebsiella pneumoniae, which is changed to pink color, but E. coli doesn't have positive or changes, which is negative. Okay, next. This is the example of the test before, as we talked before, which is this one is citrate nitrogen test. This is Klebsiella, which is no changes, blue color. It has changes, sorry, in blue color. And this one is the reagent ring for E. coli, but in Klebsiella doesn't have, so don't change. Next. And this is MR and VP test, which is methylene rate and Voges vacuum test. Okay, this rate is E. coli, and this not methylene rate. So this is Klebsiella, this is E. coli, and this one is pinkish and shows the Klebsiella. This one is Klebsiella positive, and the negative is no changes, which is E. coli. Right, next. Discussion. Okay, from this test and the observation, we know that the patient has Klebsiella pneumoniae. Why? From that, we can see the predominance of neutrophil that shows there is the bacteria inside the patient body. Okay, and then another one is the creatinine. Creatinine and urea all increase as ability the kidneys to filter fluid between the body declines. Most common reasons for developing rising creatinine levels will be the filtration mechanism become gradually damaged by long time rise blood pressure and diabetes. Okay, we can see that the rise of blood pressure as we check at the patient introduction, and the diabetes is next. Diabetes we can see from the glucose test, which is the result is higher than the normal one, so the possibility to get the diabetic mellitus is high. Okay, if the diabetes mellitus is high, the chance to Klebsiella pneumoniae is also high. Okay, from that we can show the proof on the urinalysis that the glucose also high. Okay, you can see the urine glucose also high, and the white blood cell in urine also can see, and also we can see the bacteria in urine also. Okay, next. In urine there is no red blood cells. It shows that Klebsiella pneumoniae is not from the urinary catheter. Then, as you can see, this is no red blood cell. So it's not, because Klebsiella pneumoniae can easily get from the hospital, but there is from, we can differentiate between it's getting from hospital or not by the RBC. So this is not from the urinary catheter. Okay, next, the sputum microscopy shows that there are white blood cell and negative are seen. So from that we know that the respiratory syndrome is invaded as well. The Klebsiella pneumoniae is targeting the respiratory syndrome. As we know, Klebsiella is targeting the respiratory system, but E. coli is not, because the target or pay attention on the gastrointestinal system only for E. coli. Alright. Okay, next, the growth of plate also give the strong reason for the presence of Klebsiella pneumoniae. Okay, and the antibiotic test also show some towards some sensitivity on the antibiotics, as you can see as before. Okay, the other test is serology test, indole test, metal test give other strong reason to differentiate between Klebsiella and pneumoniae and E. coli. Okay, so the end. So this is the case presentation. I hope madam or sir can understand what I'm presenting. Right, thank you.